This is The Change Physician, episode 254. Welcome back to The Change Physician. I am Melissa Cady, the Challenge Doctor, with our cross-eyed Dr. Kevin Cuccaro from the West Coast, bringing you another episode and a discussion about something we were talking about off the air. Many times, the things that are marketed out there can be, transformational or immediate, or, that amazing pill, or the before and after pictures. And but we're discussing how a lot of times the most exciting or beneficial health benefits can come from like the most boring, unexciting, less marketable habits that are like really critical to implement on a more than not basis. So anything you want to start off with there, Kevin, as it relates to that?
Yeah, I mean, I think that's like the critical thing is all the exciting results that everybody pictures. I mean, in this Instagram worthy thing where you're svelte and muscular or happy or whatever, the foundation for those are really kind of boring.
Yeah.
And I think that's the part that gets lost is there's this focus on really short-term gains and short-term quick, the magic pill. That's like the marketing thing is what, find the magic pill, or at least find the magic pill you can market in order to sell something, the magic kind of formula or whatever. But there really isn't one. And you have to just kind of focus on these key modalities in order to maintain your health, and to improve. And I mean, most people know that you need to sleep well, that your food that you eat has an impact on your health, that your movement and muscle mass have an impact on your health, and avoiding certain bad things, toxins, kind of, whether those are people, places, and or substances, is key. Smoking being one of the big ones. And last one, which doesn't get as much attention and probably is outside the scope of this, but is your connections, your familiar connections. And there's a lot of data on all those.
Mm-hmm.
And diet and weight loss and fitness is it's one of the biggest markets in the world. It's one of the top like three of the big kind of major categories when you kind of look at what people are selling. It's really, it's just a focus on the key things. These short key things will give you the best results. And from a personal example, what kind of started all this off is, way back when, like when you were doing your athletics and stuff, and I was the fat kid, like when I was in junior high and things, I was the chunk. I wore the hefty pants. If anybody remember what those hefty pants were. And I remember being very excited when my waist finally equaled the length of my pants. That was an amazing thing. And then you went through puberty and you dropped a bunch of weight and blah, blah, blah. And I worked out some when I was a senior in high school, but I never kept up with fitness. Was never a habit in my life. And so because of that, I would have these kind of fluctuations up and down. And as you become more sedentary, and you kind of change your eating. So I gained a bunch of weight in college. When I left college, wasn't going out and drinking beer all the time and eating chicken wings at 2 a.m. And so then my weight plummeted. And then I was pretty healthy going in medical school, and then medical school obviously gets busy and it's not. And then it was just kind of this yo-yo thing, because I didn't have a habit of health.
Yeah.
And it kind of came to a head about, it's like 5 years ago now, which is really, really weird to me. I would like exercise consistently. Actually, probably 8 years ago, I would be exercising consistently, and then almost without fail, approximately just before Thanksgiving, things would fall off the rails. Like food would come in and family, and you'd get busy, and then you wouldn't exercise because I didn't make it simple. And then it would be like months and months, and then you would redo it again. So it was over and over. And about 5 or 6 years ago, I became much more consistent in exercise, accelerated by the pandemic. But what I really kind of noticed was, what do people say? Like people say you need to know, you don't necessarily, know what you're eating, have a plan for consistency. And those short, being consistent over long periods of time is more likely to end in a successful outcome rather than these kind of short-term things. Yeah. And the first thing I started with was finding a consistent form of exercise that fit me. Mm-hmm. And then once you know what the keys are, is to set up your environment for success. So Some people go to the gym. Well, the gym didn't work for me well. Like I have had gym members in the past, and they have been fun if you had a lifting partner. But in the place that I was in, we have a gym literally less than like about a quarter mile down the street from us, down a hill, and all you have to do is right there. Briefly had a gym membership when we moved here, and then very quickly I realized I wasn't using it. And if you're a type of person who needs that external thing, and you have a history of when I go to the gym, I'm going to work out, then you need a gym membership. If you're not, or you're like me, a little bit more introverted, I have to make things as simple as possible, such that the default option for me to say I'm not going to exercise today, I have to come to terms with the fact that I am being lazy and I'm actively choosing not to exercise today, because there's no barriers to it for me. This comes with complexity of workout plans. I was doing for a while the Beachbody ones, which actually quite I enjoyed, but then you start getting a little did those for about 3 or 4 months, and then you kind of get tired of doing the same thing all the time, supposedly, which is funny because over the last 2.5 years I've been doing the same almost the same exercise for 2.5 years. But it's just making things easy. And then the other thing was when my weight wasn't changing, despite exercising more, I was doing lots and lots and lots of cardio, and my weight wasn't going down. Key caveat being I wasn't monitoring what I eat. I don't eat a lot of processed foods, but I wasn't like actually being mindful of what I ate. I never lost weight. So then I'm like, well, I'm going to lift. I'm going to lift heavy weights, and I'm just going to, I'll get stronger. And what had happened is then I'm consistently exercising with heavy weights. My weight never went down, but my muscle composition changed. And now I'm at the point where the last key is, so my sleep is okay. It's improved from what it was 10 years ago. We're not going to that. My exercise is consistent because I have a plan that's very, very simple. That's what I need. Some people want complexity and change, and you can do that. But for me, I have to, knowing I'm doing literally 1 to 2 exercises with a kettlebell that do a full body range of motion and full body exercise. And if I'm doing that, I was doing that, I'm doing 3 times a week. So I'm actually having increased time for my body to rest because I'm using heavier weights. And at this point in time, I can feel the muscle composition kind of like my muscles are getting bigger, and now my weight's going up, if that makes any sense. And I don't want my weight to go up anymore. I want to get the fat content down. So I'm at the final point where I have to do the really, really boring stuff of actually being mindful of what I eat. And it just blows my mind, though, because we have all these, it's not easy, but it's relatively simple. And we can all do it because there's tons of resources out here on this. Like if anybody has like, where do I start? I mean, the first thing I would recommend is start doing an exercise program and just figure out what it is that the barriers are for you. You know, what mine is, I am inherently a lazy individual. Like anything that gets in the way to derail something that I'm not super excited about doing will easily get me off track. So I have to make sure that everything's simple, not complex. I know what I'm doing. And then that I can literally step out of my door and do it right now. And that's my kettlebells are sitting in my living room, which is about 20 feet away from me right now, simply because I walk by them every time. And until I've done them for the day, they're right there, and I know I'm going to have to do them. So,
that's huge. You, of course, I'm making all these notes because you made me think of some other things, but right when you started talking, okay, this whole thing about, how health can be so much better, more exciting from our boring like habits, I immediately thought about saving money versus the lottery. Like it is a perfect example of how saving money is like this. It's a discipline. It's boring. It's not exciting. In fact, it feels like you're taking a little something away from yourself in a way, or you could say you're paying yourself, however you want to look at it. Versus like this, excitement and amazing like opportunity to win like hundreds of millions of dollars in a lottery, which a lot of it goes towards back to the government anyway. But you're also spending the money that you every time and losing money if you're not winning. So it's just an interesting concept of just the habits for saving can really create an amazing outcome later in life. But it's more long-sighted versus the short-sighted. Great if you won the lottery, but there's no guarantee and the odds are not in your favor. But and I talked about the before and after pictures. I've always felt like it's so incredible how the human mind can be so enamored or drawn into these drastic changes that really took time, but they warp speeded it for you to make it seem like, oh my God, this is the thing, when in fact these boring habits many times could have gotten you those same results. It's just like you said, some people don't acquire those, and which is really important for parents with children to model certain behaviors and habits early in life, so that, like you said, you didn't have habits and you struggled and didn't, you had to create this for yourself with simplicity. Some of the things that we've talked about before on this podcast are things for implementing change. You talked about the environment. So sometimes that can be, like you said, you just put the kettlebells right in your way where you're almost tripping on them. And then there's accountability. It could be a partner. Sometimes you need to figure out what you need to do. First of all, is reverse engineer, like, what would it take for me to get to this, whatever goal it is. But many times just going from doing nothing to something, even if just walking, can be huge. Creating a convenience. I personally found, like, anything that required like putting a lot of equipment on myself, like skiing or things that are far away, and skiing in Austin, Texas, like those things aren't real practical. For me, my favorite thing to do would just be literally walk out the door. I don't jog or run as much as I used to, but that was like my lowest maintenance, easiest thing to go do. Of course, I'd been used to working into that running. My body was adapted to it, so I wasn't killing myself or paying the consequences the following few days. And or pairing it with other activities. So I have a new puppy. So that they need to go for a walk, or you can pair it with something that needs to be done anyway. You get your walk, dog gets their walk. That's kind of an obvious thing. You could pair it with another activity you already do. You could be going to the mall for I don't know, buy something, you make yourself do several more laps while you're there, like all very paired type activities. And like you said, you kind of decrease the thinking part. If you put in too much energy, you make it too complex, and people aren't really gonna, they're gonna default to being lazy. I would say most people are like you, Kevin. Like it's just human nature. If it's not for survival and you don't have to do it in that moment, it's gonna be ignored. So it's really that having that foresight to understand that in order to have this amazing, exciting health, that you got to put in the boring work on the back end. So any thoughts about some of the things I said?
Well, I just kind of, add on there. I don't think I have really exciting health. I have good health. Like,
Well, but look, we're in the medical field. Like, we see really bad stuff from completely neglected health. Like,
and I think that's the frustrating
you might be
thing.
exciting, Kevin. You might be exciting to somebody else.
Well, and that's like the comparison. We tend to compare to something aspirational versus looking back and
you can move,
drive some dissatisfaction. Oh yeah, I mean that, and that's the that movement is the key. And I think that's our as a perspective as physicians that we have, with the backgrounds that we have, is the fact that so much of what is walking through the door and that people are presenting with is preventable. And obesity being one thing, not the only thing, but really it's the foods that we eat, it's the movement that we do or not do, and it's the mass that we lift or don't lift that are these really foundational variables. And I think at some point people think, well, they can't do it, and something is always better than nothing.
Mm-hmm.
And just doing even that little thing consistently over time has more results than the pills that are being prescribed and coming in all the time. And the people, people come in with fatigue, people come with a sundry of symptoms. You're not feeling good, joints that ache, this, that, the other thing, bad digestion, constipation, difficulty with that, abscesses and sores when they're getting in these pockets of adipose tissue. And man, I mean, the just starting somewhere
Mm-hmm.
is key. And exercise, so food gets a lot of attention. There's a reason why I'm actually, as I said, I'm actually focusing on the food part right now, the macronutrition. But I think from a movement standpoint, just doing some sort of movement every day, no matter what age you are, and lifting something heavily, that could be every day if it's not super heavy, but if you're doing heavy stuff at least 3 to 4 times a week, it is not that complex.
I have a comment.
Yeah.
Two examples just in the last few days of people and what they say. And I feel like this is one of the most important messages, and it's an intangible, but believing in change. It sounds so simple, but I have people I met that said, "Oh, yoga's not for me. I am stiff." I'm like, I can't do the yoga. I'm like, you're the person that needs to do the yoga. Or, you don't call it yoga, call it movement, call it increasing your range of motion. You don't have to put this like yoga cap on and say, I'm doing yoga. Are you going to say something?
No, that's where all the marketing comes in. It's like you name it something else, like mobility work, or
Yeah.
I don't know. I'm gonna make someone mad, but I was gonna say like Pilates or whatever. But I mean, they're all movement.
They're just different like methods of sometimes it's micro movements, or it's like holds, or it's like more frequent vinyasa. Like they have all these like different ways of doing the movement, but it's like always comes down to the thing I have a strong belief about, but also you can see it, how important it is that a variety, not just of nutrition, but a variety of movement. Like if you don't take your body there, don't be surprised it can't go there later. And
Well,
so
don't. But I guess the other thing is you don't have to. That's something that doesn't even be forced. If you don't like yoga, nobody's saying you have to do yoga. Do something
no,
else. There's a million different forms of movement that you can do.
yeah, yeah.
Um,
But
yeah.
that was my whole point. Is like your body can get better at movement. It can get better to a certain degree, whatever your genetic abilities are. If you have a structural limitation, like there's different things, but those tissues are malleable. They can change. They're constant. What were you going to say?
Well, I was like, oh, I think this is what you're really kind of getting at here is that
But
people say, I can't do yoga because I'm so stiff. Well, I think what you're basically saying is, well, you need to do something so that you're not as stiff, right?
yeah,
And it's sort of like, oh, I can't, I can't walk or I can't run because I get short of breath. Well, you better do something so that you improve your shortness of breath.
right.
Oh, my, and
That's the irony of it all.
I know. And it's like, you don't have to, not being able to touch your toes. Um, you're not going to touch your toes the first day, but bending over and stretching is
Yeah,
something you can do. And if you do, that every single day over 20 days, 30 days, 100 days, 200 days, it is, I would wager it's physiologically impossible that there's not going to be change there if you're doing that.
yeah.
Yeah.
And it is also their mind, like what's happening in that moment. What's happening to these people, the way that they're saying it, they get frustrated because they can't do it. It's like, well, you need to be patient with the process and understand the body can change and just go through the motions and it will change and then you'll be less frustrated. And then it's just this weird, crazy, like vicious cycle that I
Well,
see.
and I do think that becomes knowing who you are and what works for you. Some people where you're goal oriented and you're trying to achieve this goal. Some people are tracking oriented. Some people are, retrograde. They look back to see where they've come, and that's the most motivating for you. Just you have to understand what motivates you and demotivates you.
Mm-hmm.
I am not a huge if I'm looking too far ahead, the way my brain works, that it becomes a demotivator because my brain keeps looking way, way out in the future. for things that aren't now. Like, and people, well, look what you've done. And I'm like, well, I didn't do this. And that
Yeah.
becomes a demotivator for me.
Mm-hmm.
What does really work for me is tracking.
Mm-hmm.
The thing, the what you measure matters. And so literally tracking things every day and or what I'm doing, it provides a little sense of gain that I'm like, oh, I did it. And two, it kind of lets me see where I'm going and keeps me consistent. And but that took a long time to figure out. That, I mean, really learning who I am and that I am a lazy individual who needs to have something so simple that the default is just like stupid. Like, again, like I said, that is super core for me. And I see these posts, like I finally joined Reddit, which is like, I don't know about, people probably knew about Reddit and I'd heard about Reddit, but Reddit's kind of fascinating because you see all these little threads and people talking about this stuff. And in the kettlebell one, it always makes me laugh because there's people like, oh, I tried Simple and Sinister, which is the program I did for 2.5 years, or I tried the Giant, which is the program I'm currently on. These are two exercises. In fact, in the Giant, you can almost consider them one because it's a clean and press, which I guess is technically two, but you do them together, so it's like one. So I guess two minimum for me. I need to do, I want to do this, and that just seems too much. And I'm like, well, did you even try it? I mean, minimum doing something is better than doing nothing for 30 days, or assuming because it's so simple that you need something super, super complex with all these points of failure that you're not going to be able to accomplish. Now, as granted, if you are somebody who really likes complexity and have demonstrated that, you need 10 exercises to do of 42 different variables with weird ladders of reps all the time, and that's what you enjoy and that's what keeps you consistent, that's one thing. But if you're sitting there looking at exercise programs and then you're going, this one's only 2 exercise, that can't work for me, but you've never done it and you've never done anything else, is insane. Absolutely insane.
Yeah, you can't knock it till you try it. It's kind of like the cruises when you said you.
Oh yeah. The same. We talk about it all the time. Is until you've experienced something, you don't really have the knowledge to say whether or not it's something that you like.
Yeah, yeah.
Yeah.
You have a very different lens you're looking through. Um, what else was I going to say about? I think just adaptation and just that belief in change was kind of like what I was trying to get at. Is like there's so many components of, like, when it comes to fitness or whatever it is, like we talked about in previous episodes, power, strength, flexibility, like all these different things we can all make, especially if we're not doing much, like all of it can improve. So pick something and, like you said, try it, don't knock it. And then you can make your firsthand judgment on whether or not it was helpful or had any negative consequences for you or whatever. But starting low and going slow with any change in any activity, I'm always encouraging it. And I get really passionate about the, I do my little, ups and downs of my intensity and what I'm doing and how much effort I'm putting into things. But there's no doubt in my mind, because it was ingrained early in life with sports and other activities, that there's no way in God's green earth that I will, unless I'm like physically incapable. And granted, you mentally have to have that will to do it, but there is no way that I want to be inactive at any point in my life. Now, the intensity will change with what my body dictates, but I think we mentally minimize the capabilities of our body way more than we should. But anyway,
Well, to wrap that into kind of what you also said, without blurring episodes too much, because I don't want to do that. Yeah. But what you said is, like, there's really these simple, consistent behaviors you do on a path to wealth versus the short kind of deflections, like the lottery tickets and that kind of thing, or the fancy, super high complex thing when you haven't even invested in a basic index fund. You're looking for something super complex.
Yeah.
That simple path towards wealth. There's the simple path towards health, and they are 100% related. I know we've talked about this before, because I see these people, oh, you need to save an extra million. Like, everybody has an extra million running around. for your long-term care because you're going to be decrepit in your old age. Oh yeah, okay, maybe save some money, but on the other hand, how about actually putting a focus on your health now, where you're walking every day, or maybe you're doing farmer carries, which is where you take two heavy weights and literally walk with those like for 30 seconds and then do a couple sets of those, which is a whole body set of exercise, and do that as consistently such that you don't need that long-term care because you're so decrepit. Like my goal for health is, what was Alan Simpson? Did I bring this up? Alan Simpson, who was a senator from Florida, was a single term Florida senator during the Obama administration. And it was when there was all this debate about the Affordable Care Act. And he came up and gave this speech on the Senate floor. And he was a Democrat, and he was kind of criticizing the Republicans who are so anti everything. And he's like, the Republicans' plan for health is don't get sick. And if you do, die quickly. And I remember hearing that. I'm like, damn, that's a good plan. And I'm like, you guys heard I'm like, not when you're like the current Republican thing. I just drives me crazy. But when it comes to health, like that's my goal. And actually, I'm like, that's a pretty damn good health plan. If we have the tools to help people don't get sick, and then if they get really sick, instead of like spending all the money we do on end of life care, instead we just make them keep people comfortable and we all die quickly. That to me sounds fine. That's what I want to do. I'm just like, my goal is to, work out, exercise, improve my sleep, improve my nutrition. I don't smoke. I don't use tobacco products. I don't drink a lot of alcohol. So we're avoiding those things. I'm trying to improve my connections, which is a huge one, since your number of close connections at age 50 predicts your health at age 85. But when I do finally get sick and decrepit, my plan is to die quickly. I'm like, I'm not gonna. I'd rather have a long, healthy health span than a long, decrepit lifespan, which was something we talked about recently as well.
Yeah, I totally agree with that. Absolutely. And I had a thought in the middle of you talking, and now it's gone somewhere. So we'll just let that one go. Well, I think our point behind all this is that we're trying to empower people that you have a lot of impact on your own health for the future. And that can be the most exciting thing too. And it does come from boring habits. I guess it depends how you look at them, but
well, I think the biggest thing, and because I want to end this on something actionable, like a lot of times we talk, and I enjoy talking with you, but sometimes if it's an external person, maybe they're like, oh, but you're not telling me anything specific. Well, here's something specific. Pick one domain of your health that you want to work on, then choose something that you're going to do and be consistent about for the next 100 days, and then monitor it. Well, what about specific there? Well, if you're we're talking about a lot about movement here, pick some sort of single base movement and do it for the next 100 days. If you want to do, it has to be something easy, something that you can either do at home or with minimal effort. So maybe it's you're at the hospital, you're going to take the stairs every day. That's all you're going to do is take the stairs instead of the elevator for the first 3 flights or whatever. I mean, if you work, in one of these high rises with 14 stairs, I know that'll be a little bit more difficult. But say the first 3 flights you'll always do, and just do it for the next 100 days and then see what happens. If it's not that, maybe you have a set of dumbbells. You're going to do a compound lift. Like I'm big into the clean and press because that's what I'm doing right now. You can do that with dumbbells. You can do it with barbells. You can do it with kettlebells. Do 3 sets of 5 with whatever that weight is for the next 100 days. You're going to see a difference. So don't make it too complex. Whatever it is, the key thing that whatever's easiest for you, and then just do it for 100 days and make it not complex, but so minimal that if you choose not to do it on a day, but you shouldn't for the first 100 days, but if you choose not to, it's because you are telling yourself, I am choosing not to do this because I'm lazy and I don't want to do it, rather than, I just didn't have the time, or, everything was overwhelming me today, and blah, blah, blah. All the excuses that we give because we all have the same 24 hours in the day. And we're going to use that as an excuse for a lot of different things. But once you take the excuses away, it just becomes charting it day for 100 days and then reevaluate where you are.
So before you take us out, I'll say I think I will make my one movement for this month to start to be I have an over the door pull-up bar.
Mm-hmm.
So put it in the way where you're going to see it. And every time you walk through the doorway, even though it's been a while, I used to be able to do pull-ups into the teens. Like for a woman, that's kind of like a big deal. um, but even if I can't pull myself up, what I do is I jump. So modifications when you can't actually do the thing. And I just jump up and hold myself up for as long as I can. And then eventually slowly lower myself down. And then eventually pull myself up. And then see over the next 3 months. Actually, I'm thinking through the end of the year, see where I am and what those changes and what's exciting from that little boring habit.
Yeah, well, let me write it down. So Melissa's
Pull-up challenge.
daily pull-up challenge. Yeah, I'm gonna write that down so we can check in on that in 100 days from now. And
Yeah.
I love that because that's super easy.
It'll make me stronger.
It is. And way back when I was in high school, I did, or yeah, when I was high school, in my toilet in high school, I had a pull-up thingy. Actually, I had like one of those, what are they called, solo flexes or whatever, but you could put it in this position to make a pull-up bar out of it.
Mm-hmm.
And that was something I did, was every time I walked into my room, I had to do a pull-up. And holy crap, I swear to God, by the end of, I mean, obviously I was 18 at the time,
Mm-hmm.
but I think before I started college, I was doing like 20 pull-ups. I mean, it was crazy.
Yeah.
So I'm excited for you. And I think, again, like, folks, that's a good one. Other one to put some heavy weights on the ground and pick it up. Like,
Yeah.
literally just pick it up every day for 100 days. You're going to see a difference.
Yeah.
Period. So the 100-day challenge, you heard it here. And Melissa's pull-up challenge.
Yeah, I'm gonna put it in my doorway to my office.
There you go. There you go.
It's gonna be passed through on a daily or near daily basis. So perfect. Well, why don't you take us out?
Sure. Well, thank you all for joining us today. We're talking about the, very boring things to do for exciting long-term results. As always, if you have any comments or questions or want to discuss something, you can email me directly at drkevin@thechangephysician.com, or you can join the community at thechangephysician.com. And until next time, stay well.
Take care.